Our new host, Renata Singh.
Hey, it's your girl Renata, and you can join me and my special guests every Tuesday from 12:15 to 1 p.m. as we touch on issues that impact women of all ages, from knowing your worth and identity in Christ, fostering godly relationships, beauty, fashion, maintaining a healthy lifestyle, and more. And of course, we bring a biblical perspective to every discussion.
It's Woman of Promise, the Grand Reset, every Tuesday from 12:15 to 1 p.m. on Isaac 98.1 FM. Sponsored by Furniture Plus.
Trinidad and Tobago. I am Renata Singh and welcome to Woman of Promise. Listen, y'all. Tiffany took us way back with that medley just now. Listen, I went all the way back to primary school. Listen, those were some tunes. I was definitely enjoying it. Thank you so much, Tiffany, for that throwback moment there. I know you guys listening would have been vibing as I would have. Joining with me today is Dr. Hazel Otalo. Of course, we are continuing the discussion from last week on mental health. Just to kind of recap, if you missed last week, we spoke about just the different levels of mental health, and also we discussed the idea that mental health illness is as critical and can be as critical as any regular, well, not regular, but you know, some of those illnesses that we're familiar with, like heart disease and stuff like that. The ones, you know, we quote unquote take more seriously. Dr. Otalo, thank you so much for joining me today.
Thank you for having me.
All right, I'm excited for this discussion. Today we're going to be kind of building on the discussion last week. I think I want to ask, what are, if there are any prevalent mental health illnesses in Trinidad and Tobago?
Yes, the same mental disorders that could be found in any other country are found in Trinidad, and the prevalence tends to be roughly the same as you would find in any population. So, for instance, the most common disorder is depression.
Okay.
People tend to associate mental illness with the psychotic person who's lost touch with reality and who's doing and saying strange things, and they think that's it.
Yeah.
But that's just a drop in the bucket, right? Depression could affect as much as 25% of a population. It's quite prevalent, more prevalent in women than in men. And we also see quite a lot of anxiety.
Yeah.
That's very, very prevalent. Schizophrenia, which is the most common psychotic disorder, only affects 1% of your population.
Wow. Okay.
So it gets the most attention, but it's really not that prevalent.
Okay.
You know, we give attention to the things that draw us towards them in a certain kind of way, the things that we give the headlines.
Yes.
So if somebody is hallucinating and that's something we don't quite understand, so we may stare at them, or we may be confused.
Is it because, do you think, like, just because perhaps there are more physical signs that it gets
It's more
that
visible.
level?
It's definitely more visible because it affects behavior in ways that we associate with mental illness. Other mental disorders affect behavior, but unfortunately we associate those changes with our own preconception. So we say somebody just being moody.
Yes.
Because they looking sad, or if they're irritable, what's wrong with them? Why they getting on so? Why they so huggish?
Yeah. No, that's
Right?
real.
So we put cultural labels on the symptoms. Right? Somebody's anxious. Why not just relax?
Yeah.
It's out of their control at that point, you know. So we have all the same illnesses. We have, we see other disorders. For instance, the disorders that affect children more frequently, things like attention deficit disorder, conduct disorder. We see it all.
Okay, and how much of our kids are impacted by this?
A small percentage, but a significant percentage, and enough enough to make me emphasize that the care that those kids need, it's important that it's available to them. Unfortunately, a lot of children with mental health disorders are never diagnosed or misdiagnosed, or rather labeled instead of being diagnosed,
Okay, got you.
and never get the care that they need. You know, it's like long time when a child having trouble with their vision and they gets put in the back of the classroom and they can't see anything, so they start to make mischief because they don't understand what's on the blackboard, and then their grades start to drop. And what do? They get licks.
Yes.
And it doesn't dawn on anybody
That it
to check this
perhaps
child's
is.
eyes. A simple solution.
Yeah. What could parents be looking for in kids that may have mental health disorders?
It's important to have a sense of what the normal development of a child is.
Okay.
If you've been around children or you've raised other children, you tend to notice that this child's milestones may not be developed at the same pace as the others. And if, as time goes on, that child isn't catching up, then there may be a need for that child to be properly evaluated so that you could know what level of support that child needs in order to thrive. If you start to see changes in a child's behavior, changes in their personality, that child may be responding to some trauma that you are unaware of, right? So very often children who experience abuse start to become withdrawn. Their school performance deteriorates. They may start to act out, and all adults sometimes sees the behavior change and think they're just quote unquote miserable.
Yes.
Right? So it's important when we see changes in a child, well, it's either developmental, where the child doesn't develop as they should, or they're developing well, but then we start to see changes that we don't quite understand. It's important to have them evaluated and have a professional bring those parents or caregivers to a proper understanding of what is happening with that child so that the appropriate level of support can be provided.
I love that word support. I mean, have had interaction with kids and parents throughout my life, and I think sometimes it's a difficult conversation to have with parents for them to even come to the point where, hey, let's take this step. Not even we didn't even reach diagnosis yet. Let's just take this step to go speak with a professional in this particular area. Speak to those parents, because I know it's a touchy thing.
It's difficult for any parents to acknowledge my child has a mental health challenge or my child has a developmental delay. That's there's so much stigma around mental health that unfortunately society sometimes sees that child as being less than the rest of children. And parents have a little fear of that. So it's hard for them to acknowledge that this is happening to quote unquote my child.
Yeah.
It can happen to other people, sure,
Yeah.
but it can't be happening to my child.
Yes.
We don't have that in our family.
Yeah.
Really? All your family? Who knows all their family? Right?
Good point.
But, you may not know that
Yes.
it may have been 2 generations back.
Yeah.
And it may not, and it's because of stigma, it may have not been spoken of.
I mean, and that's the case.
It was kept hush-hush.
Long ago that nobody spoke about.
That's right. These things were
mental
kept
health.
hush-hush,
Correct.
and that child was isolated
Yep.
from the rest of the children because you don't want them to quote-unquote embarrass you in their behavior.
Yeah.
Right? So now we understand these things better, and there is enough research has been done. We don't know everything, but we know enough to be able to identify what works and what can assist and what can support. So now we have children with autistic spectrum disorder thriving and developing well and living up to their full potential. Right? I had the pleasure of listening to an autistic young man play his saxophone at an event I attended. It was amazing. It was wonderful. And when you see that, these parents got it right.
Yeah. So tell me, how important is it for early detection? Because
Absolutely
we're looking at,
important.
okay, this is a child still. Does it impact if it's not dealt with at that stage when you're a child? Does it impact
The
us going into
earlier,
adults?
the better.
Okay.
Particularly developmental disorders that affect academic performance. Because in many cases, with the correct level of support, that child can still achieve it a lot more than they would achieve without the support.
Okay.
Okay, so that sometimes the child may need additional coaching. Sometimes they may need special schools. That's not always the case. Not every child with a developmental disorder needs special school, right? But some different children need different levels of support, so it's important, it's absolutely important to have that diagnosed early so that as soon as possible, that child could start getting the support that they need so that they can thrive.
Okay. And it does impact like their life.
Yes.
Yeah, like if we don't catch it early.
If it's caught early and the child is supported, and the child as they grow older they understand better what this is and how to cope with it and how to deal with it and how to thrive in spite of it, that has implications for that child's self-esteem.
Okay.
That has implications for that child's holistic health, excuse me,
Sure.
going forward. Right, so it's not just about academic performance and achieving goals. It's not about passing SCA for their first choice. That's not the only thing.
Yes.
It's about their whole life, their whole development, and their ability to just be the best that they can be.
I absolutely love just the way you keep saying that word, support, and that's where it's at. We have to find ways, yes, deal with the elephants in the room. It may be difficult at first, but guess what? We owe it to our kids, I think, to give them the best shot at this life, and this is perhaps a part of that. But we're going to go to a short break. When we come back, we continue this discussion. Don't go anywhere.
Woman of Promise is back. The Grand Reset with our new host, Renata Singh.
Hey, it's your girl Renata, and you can join me and my special guests every Tuesday from 12:15 to 1 p.m. as we touch on issues that impact women of all ages, from knowing your worth and identity in Christ, fostering godly relationships, beauty, fashion, maintaining a healthy lifestyle, and more. And of course, we bring a biblical perspective to every discussion.
It's Woman of Promise, the Grand Reset, every Tuesday from 12:15 to 1 p.m. on Isaac 98.1 FM. Sponsored by Furniture Plus.
Better living starts at Furniture Plus. Get up to 50% off on furniture, appliances, mattresses, and more. Plus free gifts with select purchases and just $1 down on credit plans. Don't wait. Visit Furniture Plus today.
If you're now joining us, I am with Dr. Otallo. We're continuing the discussion from last week on mental health. Dr. Otallo, anxiety and depression. I think that's one of the things that we hear quite often. Is there a difference?
Yes. There are things in common. They are both mood disorders.
Okay.
Right? They both affect how we feel emotionally, so we call them mood disorders. They both affect the same parts of the brain,
okay,
and they involve the same brain chemistry.
Okay.
So that there are similarities. We experience anxiety differently from the way we experience depression. However, in terms of when we talk about anxiety, we're talking about symptoms. We're not talking about a disorder, because there are lots of different anxiety disorders.
Okay.
Anxiety can express itself in different ways.
Oh, wow.
Yeah.
Okay.
There's generalized anxiety disorder where people are just anxious all the time and they can't control it. There's panic disorder where somebody may not be anxious all the time, but from time to time they get this intense wave of anxiety that takes them into a panic state.
Right.
And that could be so bad that they may think they're having a heart attack or something.
Yeah.
Right? I think most of us would have seen a friend or a relative or somebody go through that, and it's difficult to look at.
Yes.
Especially if you don't know how to help.
Yes.
Right? And then there's things like post-traumatic stress disorder. The person who was raped or attacked or served in a war or had a bad motor vehicle accident, whatever, some traumatic experience. And after the experience, they continue to relive it. And every time they relive it, they feel the emotions that they felt at the time of the incident. So it's like emotionally they're living this thing over and over again.
Wow.
And it can be associated with a number of psychiatric symptoms. So it could be associated with depression, it could be associated with anxiety symptoms, it can sometimes be associated with hallucinations and things like that. Right? So there are different anxiety disorders. Similarly, there are different depressive disorders. So when we say depression, it's just a broad term, right? I always like to emphasize that there's a difference between feeling sad and suffering from a depressive disorder.
I was going to ask you that.
Everybody feels sad.
Right.
We all go through experiences that make us sad. Grief is not an illness. If somebody dies and you're sad, that's part of life. We go through it. Most of us get through it. We adapt. We move on. We eventually remember the person with joy and with, focus on the good memories. And the pain eases up over time for most of us.
That's normal.
That's
the
normal.
way.
That's normal.
Great.
There can be complicated grief where people go through a prolonged and extreme duration of what would otherwise be normal grief.
Okay.
It's just longer than it should be.
But we're still not talking depression.
But we're still not talking about a diagnosis of depression.
Okay.
For you to be diagnosed with a depressive disorder, as with any other disorder, you have to meet certain criteria.
Okay.
Right? As psychiatrists, there are criteria that we use for making diagnosis. So within the Americas, we tend to use what we call DSM, the Diagnostic and Statistical Manual. We're currently at DSM-5. It started, every time it gets edited, the name changes.
Right.
So when I started working in psychiatry, it was 3 revised, and there was this excitement when 4 came out, and then there was 4 revised.
And now you're at 5.
And now we're at 5.
Loving it. Shows progress, right?
Progress. More research gets done. Things get fine-tuned. It doesn't mean that, for instance, there are things that are no longer deemed a disorder that used to be considered an illness long ago.
Okay.
Right? There was a time when homosexuality was deemed a mental illness.
Okay, wow.
We know now that it is not a mental illness.
Yeah.
Right? We could describe it in other ways, but it's not a mental illness.
Yeah.
Right? So there are things that were removed when people began to understand more. There is a whole area now called cultural psychiatry, where, for instance, things like, what we call it, when, you break up with somebody and you're going through, what you call it, tabanka?
Tabanka, yes.
Tabanka is now in the DSM.
Really?
Under cultural psychiatry.
Happy to hear that. Which means 20 people could probably read it and understand.
Yeah, because it's a cultural name.
Yes.
But for a universal experience.
Yes.
Right? People in every country experience pain when a relationship breaks up and, in a certain kind of way. So that that area is just growing.
Yeah. So at what point do you come to the point of, hey, this person has depression?
Great question. It's the same for depression as it is for most other psychiatric disorders. Anybody may have features of a disorder. You may have some of the symptoms of a disorder, but it doesn't mean that you have the disorder. To be diagnosed with this disorder, you have to meet specific criteria. For depression, you have to have depressed mood for more than 2 weeks, or loss of interest for more than 2 weeks. People lose interest in all the things that normally excite them, or that they normally enjoy. And in young people, in teenagers and in children, it may express itself, instead of a depressed mood, but by irritable mood, irritability,
Okay.
and the behavior changes that come with the irritability, right? So those are the absolutes. And then there's a long list of other things that you can have different, for instance, sleep changes, appetite changes, concentration, energy levels,
Yeah.
ability to socialize and enjoy and participate in life, really,
Yeah.
right? Because sometimes people just isolate in those moments. In the worst case scenario, suicidal behavior. People can have suicidal thoughts at any stage in the illness.
Yeah.
Doesn't mean they're going to harm themselves. But when it moves from thoughts to plans to intent,
Yeah.
and unfortunately sometimes the actual act, there's that progression that we always have to be mindful of and try to intervene before it gets to the
To that
more
stage.
serious stage.
One of the things that you said just now, in terms of just sometimes there may be symptoms present, and something that I've found people do quite a lot, Google.
Oh, jeez. Yes.
And so they
Dr. Google.
self-diagnose themselves. Oh my gosh, I am meeting all these criteria. I am depressed.
I've had both positive and negative experiences with that. So I don't beat up on the patient for doing that.
Yeah.
I just bring clarity to the situation. But for instance, I remember years ago when I was working in the Cayman Islands, a young lawyer walked into my office and she said, "Doctor, I have ADHD and I came for you to give me a prescription for Strattera." And I was like, okay, can we slow this down a little bit? Let's start at the beginning. And I started to ask her the requisite questions that you need to ask in order to evaluate whether or not somebody
Yes.
has attention deficit disorder.
Yes.
Turned out it was attention deficit disorder rather than attention deficit hyperactivity disorder. She didn't have any hyperactivity.
Okay.
So it was ADD, not ADHD, right? But yes, Strattera was a good choice. She had already done her research. So I wrote the prescription.
Yeah, but she did the right thing.
She
which was
did the right thing. She
coming
went
to
and
you.
got help.
Correct.
She
I
got
think
it
that's the key point. So
evaluated.
beyond the Googling, because it's okay to
It's
get
okay to do
information.
some research, but you have to be careful with that.
Yeah.
So you may be right, but you could be wrong as well. And if you're wrong and you set about treating yourself, that could be dangerous. So the most important thing is to go and see a professional, have it evaluated, and have someone determine because you may have some of the features of an illness, but you may not actually have the disorder, right? The difference between traits and trends and things like that and the actual illness or disorder usually comes down to the ability of the fact that this thing is causing significant distress or is impairing function. So you may have something going on there, but it's really not distressing you and it's not distressing anybody else.
Okay.
Somebody observing it and telling you have a psychiatric disorder is just out of place.
Yeah.
And it's just wrong,
Yeah.
right? That's just part of your personality, right? I mean, I tend to be very organized. I try to, well, not right now, but I try to be very organized.
Okay.
And in that regard, I may have some features of obsessive compulsive disorder,
Right.
but I don't have obsessive compulsive disorder.
Got you.
Right? I can be sometimes so preoccupied with keeping things organized and getting things done the correct way and making sure that all my boxes are ticked that somebody may think I have obsessive compulsive disorder, but I don't. It doesn't cause me any distress.
Okay.
My behavior doesn't cause anybody else any distress. And it certainly doesn't impair my ability to function.
Well, that is such a clear picture, because you're right. We might look at people and be like, oh my gosh, you're a little too, why are you so organized? But I love that point you made. It's not causing me distress, nor is it causing anyone else distress. So those are important factors. Like we can't, that's why it's so important we speak to professionals like
Yes.
yourself to give that level of insight and intervention when needed. But we're going to go to another short break. When we come back, we continue this discussion. Don't go anywhere.
Women of Promise is back. The Grand Reset with our new host, Renata Singh.
Hey, it's your girl Renata, and you can join me and my special guests every Tuesday from 12:15 to 1 p.m. as we touch on issues that impact women of all ages, from knowing your worth and identity in Christ, fostering godly relationships, beauty, fashion, maintaining a healthy lifestyle, and more. And of course, we bring a biblical perspective to every discussion.
It's Women of Promise, the Grand Reset, every Tuesday from 12:15 to 1 p.m. on Isaac 98.1 FM. Sponsored by Furniture Plus.
Better living starts at Furniture Plus. Get up to 50% off on furniture, appliances, mattresses, and more. Plus free gifts with select purchases and just $1 down on credit plans. Don't wait. Visit Furniture Plus today.
Welcome back to Women of Promise. I'm with Dr. Otalo. Dr. Otalo, what are the dangers of self-diagnosis?
Well, danger number one, you're more than likely not going to get the appropriate treatment that you need.
Okay.
That's the most important thing, right? You may either not get treated because sometimes you're self-diagnosed, you come up with something that is scary, so you're afraid to approach a professional because you don't want to be told that that is what it is. Okay. You know, it's like feeling a breast lump and being afraid to go to the doctor because you don't want to find out that it's breast cancer. Yes. And it may be a benign lump that just needs to be removed. And even if it's cancer, the quicker you get it out, the faster, the better. Yeah. Right? So that you may delay treatment, and during that period when treatment is delayed, depending on the disorder you have, you may go through so much unnecessary suffering and unnecessary as in preventable, right? Go through all kinds of difficult situations. For instance, somebody who's very depressed, their motivation is gone. Their concentration could be very, very poor, and it can affect their ability to function in the workplace. Okay. Now, if your job is stacking shelves in the grocery, you might be able to continue doing that. If you're working in the grocery and you're the person in charge of stores, so you're in the back with the boxes and nobody has to interact with you except they come for a particular box and you give it to them and sign it out. Yes. And go back and sit down or whatever, you can hide that for a bit longer. Okay. But if you are the bank manager, how do you hide that? Right? If you are making important financial decisions and your concentration is gone, and you're working in a work environment where if you make a mistake, it can have far-reaching implications, you don't want to take too long to get diagnosed and get treated, because depression affects everybody. It doesn't say, well, you know, you're bright so I wouldn't bother you, and you're successful so I wouldn't. No, anybody can suffer from depression. Like I said last week, if you have a brain, you can get depressed. Yeah. Right? So that it's very, very important that people get diagnosed early so that they can not just get treatment, but get the right treatment and get it early in the course of the illness.
Are kids also susceptible to being depressed?
Yes, children can become depressed. Okay. Particularly children who have endured trauma. Okay. Yeah, they can and they do. And again, it's treatable once diagnosed. And treatment doesn't always have to mean tablets.
Okay. I think we always go there.
Yeah, we always think treatment means medication. And that's one of the things that parents are most scared of when they talk about treating children. Don't medicate my child. They're scared. Yes. Because they don't know what the side effects of the medication is, which is a reasonable concern. Right? So that it's really, really important that as practitioners we explain things in ways that the patient can understand, and in the case of children, in ways that the parent can understand. Right? So if you explain what the potential side effects are, but you also explain that the benefits outweigh the risks.
Okay.
And you explain that, look, because you read a possible side effects on the back of the box doesn't mean that everybody who takes this tablet gets this thing.
Yes.
My husband looks at those ads on the TV when they go to it may cause and they start to go down the list. He says, "You just prescribe them thing for people? How you can give people them thing?" I'm like, "No, darling, it don't work so."
Yeah.
The vast majority of people who take it do not get those
that's
side
like
effects.
a normal human response. We would hear all the negatives, and sometimes again, the negatives don't outweigh the positives.
That's right.
But all we hearing is what could happen, and you spoke about
Once
that.
a side effect has affected somebody and it was reported, it has to be listed, so
Okay.
you will find it in the research. But it may affect one in every 500,000 people.
Okay.
If you are that one, okay, that's not for you, right? If I use a particular tablet, Voltaren, right? If I use Voltaren or Ulfen or any version of that drug, diclofenac, I get nosebleeds.
Okay.
I've never met another person who got nosebleeds with it. They're out there somewhere,
Yes.
but I've never met another one.
But
So
you're the one in that case.
I know not to use that.
Yes. Yes.
So if I have a pain, I use something else, right? So certainly, so you can't deny that side effects can sometimes be problematic. But I tell my patients there is no medication on the face of the earth, not even the ones that get labeled natural,
Right.
because stinging nettle natural, right? We're not going to rub it on your skin,
Yeah.
right? So not even things that get labeled natural
Yeah.
are free of adverse effects.
Okay.
Anything can have adverse effects, but they may never affect you.
Okay. Beyond tablets, what are some other ways that what you would prescribe as
There's a wide range of therapeutic interventions that can help people who suffer from depression. Most frequently we refer people for some form of psychotherapy so that they can work with a trained therapist who can help them develop coping skills, help them build their resilience, help them. Sometimes they need to get to the root of what's causing their stress. If it's, for instance, early childhood trauma, then they have to face that and deal with it and find a healthy way to move forward without that event continuing to traumatize them for the rest of their life. So that there's a whole range of different kinds of therapeutic interventions. For instance, there's one that's quite popular called cognitive behavior therapy.
Okay.
And I like to tell people cognitive behavior therapy is being transformed by the renewing of your mind. Someone said there's nothing new under the sun.
Yes.
It's simply researchers figuring out what the Bible said a long time ago.
Okay.
It's and breaking it down in easy steps.
The
So
how
that
to.
people the how to.
Yeah.
Right? So you learn how to identify what we call maladaptive thoughts. The thoughts that trigger you, the thoughts that make you get anxious.
Okay.
How thoughts tend to snowball, right?
Yeah. Yeah.
So you identify where this starts, and then you start to replace those maladaptive thoughts with adaptive thoughts that help you to adapt to your situation or to cope or to function better in the midst of whatever it is. So you stop saying to yourself, I'm going to fail this exam because I'm not bright enough.
Yes.
And you start saying to yourself, I can do all things through Christ who strengthens me. Cognitive behavior therapy.
Wow. I love if you broke that down and just brought in just the word. That is something I can, it's so easy to miss because we'll be like, we're looking at the science, but there is also a lot of truth in there.
And the therapists understand the steps because it doesn't happen automatically. It takes work, and they can help you do the work.
Yes, and sometimes as Christians, we go one route. We're like, oh my gosh, if I go to a doctor or I start taking medication, I have no faith.
Faith without works is dead.
Exactly.
If I tell people, if you feel a pain in your chest, There's no pastor, no priest, no imam, no pundit, no religious leader who's going to tell you don't go to the doctor.
Yeah.
Why is it that when people are suffering emotionally, Christian brothers and sisters tell them, no, don't go to no psychiatrist. You don't have no mental illness. You're just going through a little something. All you need is some more faith. No, you need the faith to believe that the help that is available to you will work, it will help you, and you will get through this. Having done all to stand.
Yes.
You got to do the all.
Yeah. In terms of tablets, because this is a question that often comes up. Am I going to have to take this for the rest of my life?
Yes. That's always the question. And the simple answer I give patients is that I can't answer that with any level of certainty because I'm not God.
Okay.
I can tell you what the landscape looks like. I can tell you what the possibilities are. And then we can hope for the best. We can work towards the best. And if the outcome doesn't always line up with what we're working towards, we will adjust as we go along.
Okay.
Because there are some disorders where people have to take medication for the rest of their life, in the same way that a diabetic or a hypertensive or an asthmatic or an epileptic, and I could go on and on, may have to take medication for the rest of their life.
Yes.
But the purpose of that medication is so that you can live your life to the fullest without this illness destroying you.
It's the same for me.
It's the same thing. If you're hypertensive and you don't want to get a stroke, you take your hypertensive tablets and keep your blood pressure down. If you're diabetic and you don't want to end up in a diabetic coma, you manage your blood sugar in all the ways that you've been taught to do, including your insulin or your tablets, but also your diabetic diet and your exercise and everything else, in order to be healthy. Mental health is no different. The brain is an organ of the body. It requires the same level of care that other organs of the body require, and yes, sometimes that involves medication. In some cases, it's for the rest of your life. There's some disorders where once you're feeling well, you may need to stay on medication for a period of time in order to consolidate that recovery and reduce your risk for a relapse.
Okay.
Right? And again, it's very similar to iron deficiency anemia. If you're anemic, the day your blood sugar, your hemoglobin reach 12.5, you don't just decide I'm not taking any more iron.
Right.
Because if you do that, your bone marrow stores will be depleted overnight,
right.
and you'll be anemic again in a couple of weeks or months.
Okay. Same concept.
Same concept. You just keep taking it in order to maintain your recovery.
Okay. And are there cases where persons, there's early intervention, they caught it, they did the right thing, they came to a professional, if whatever sort of intervention, if it's medication or other sorts of therapy like you're mentioning, have you seen cases where they've not gotten a relapse?
Yeah, there are people who have a single episode of a particular illness, get treatment, and never have another episode. That's entirely possible. Right? That's why I tell the patient, look, let's work towards the best possible outcome. Right, because that's the ideal outcome.
Yes.
A single episode with no relapses for any illness is the ideal outcome. So it's no different from other medical disorders.
Okay. All right, Dr. Otallo, thank you so much for just sharing, your wealth of knowledge with us. I think I have a much better understanding in terms of mental health and just the approach that we should have towards it. With a measure of intentionality sometimes, because sometimes we need to be intentional, proactive.
Yes.
When, if you're seeing some of these symptoms or signs, you probably Google. Take the next step.
That's right.
Take the next step. Don't just stop there. I think it would be better to hear from a professional, hey, you're just going through a little season, as opposed to you just assuming that you are. Like you're mentioning, early intervention is where it's at, and you guys should definitely pursue that. But just in wrapping up, what's available to persons in Trinidad and Tobago? So they're kind of leaning on, hey, I may be struggling in this area. What's next?
Okay, the quickest way to find pretty much all the options available, particularly those that are available free of charge in Trinidad, is to go to a website called findcarett.com, FINDCARETT Okay. That's a website that was developed by the Ministry of Health in collaboration with Pan American Health Organization, PAHO,
Okay.
and it basically outlines the clinics and the regional health authorities, and it's not just this help for the symptoms, but it also addresses a number of things that impact on mental health. So there are resources there for substance abuse, there are resources for domestic violence, there are resources for homelessness, there are all kinds of resources on that website, right? So that instead of me giving you a list of numbers that you will probably forget, just write down FINDCARETT.com. For those who want to use the private services where you have to pay, that's fine, but FindCareTT.com focuses on the services that are free of charge.
It's a good place to start. That's FindCareTT.com. If you missed it, Dr. Otalo, any closing words for us?
Closing words, yes, there's no health without mental health. So be intentional about what we call self-care, taking care of yourself, and support others when they need it, and don't be ashamed or afraid to seek help when you need it.
Yeah, definitely leaning on that last portion that you mentioned there. There is nothing to be ashamed of, and I will end saying something that Dr. Otalo said last week and this week. If you have a brain, you can get depressed.
That's right.
I hope that kind of breaks down those walls and makes you feel a little bit like, I'm the only person possibly dealing with this. This has been such a beautiful discussion. Definitely very edifying for persons listening. Thank you so much to those of you listening. I'll catch you next week Tuesday. We'll continue this discussion on mental health. Take care.
I take a look in the mirror and all I say, no filter me there. 'Cause I love the way I am, so I say, no filter me there. Straight out the Father's hand, so I say, no filter me there. 'Cause I'm wonderfully made.
Woman of Promise is back. The Grand Reset with our new host, Renata Singh.
Hey, it's your girl Renata, and you can join me and my special guests every Tuesday from 12:15 to 1 p.m. as we touch on issues that impact women of all ages, from knowing your worth and identity in Christ, fostering godly relationships, beauty, fashion, maintaining a healthy lifestyle, and more. And of course, we bring a biblical perspective to every discussion.
It's Woman of Promise, the Grand Reset, every Tuesday from 12:15 to 1 p.m. on Isaac 98.1 FM. Sponsored by Furniture Plus.
Better living starts at Furniture Plus. Get up to 50% off on furniture, appliances, mattresses, and more. Plus free gifts with select purchases and just $1 down on credit plans. Don't wait. Visit Furniture Plus today.
Isaac 98.1 FM. Listen to us at home, in your cars, on your way to work, or in the office. Tune in now and listen live.